Hey guys, so I recently had a question from someone who was on Humira and they wanted to know if there's any type of alternative, okay? Well, first of all, I want to tell you, if you're taking this medication, I'm not telling you to come off your medication. Check with your doctor. This video is just to give you some background information for you and your doctor to do research in some possible alternatives. The thing you need to know about Humira is it is a blockbuster prescription drug, okay? And blockbuster meaning it's over $1 billion. In fact, last year, the sales were over $16 billion. And if I'm not mistaken, it's the top selling drug. What it does is it lowers inflammation. So it's an anti-inflammatory. Okay, so there's a lot of people out there that have inflammation, whether it's arthritis, bursitis, tendonitis, all the itises, or autoimmune. And this drug targets inflammation. One of the big problems I see in America is that we are on way too many prescription drugs. 70% of the population is on at least one drug in the US, with over 4 billion prescriptions written in the US every single year. That's 13 medications for every man, woman, and child. I think that's a little excessive. What do you think? With over 30% of the prescriptions never even filled because it's expensive, okay? And it's hard to afford those medications. So what I'm going to recommend is a different solution to actually fix the underlying reason why you have inflammation. And I'm not going to recommend going to the health food store and taking a pill, turmeric, or some type of omega-3 fatty acid to try to get rid of your inflammation, because I've been in practice for 30 years. Those things do not work unless you fix the person's eating, their general eating plan. Okay, glucose is highly inflammatory. It's a potent trigger for inflammation, okay? That includes all types of sugar. Vegetable oils that you would get in the store, soy, corn, canola, omega-6 are also inflammatory. And then we get to insulin, okay, is anti-inflammatory. But high levels of insulin in your blood are inflammatory, okay? So it can go either way. So what happens is that when you consume too much glucose or sugar or carbs, okay, what happens is you're going to start increasing insulin. And then the insulin is going to develop into a condition called insulin resistance. So it's not going to work anymore. So that means on the inside of the cell, we're going to have low amounts of insulin. So remember, insulin is anti-inflammatory. So if you don't have enough, you're going to get the opposite effect. Yet in the blood, because of the feedback mechanisms, you're going to start developing higher and higher amounts of insulin to try to connect and create the effect, because insulin is trying to lower this glucose in the blood. So we have a situation that we have insulin resistance, and that is creating more and more inflammation, okay? And if you just do research on insulin resistance, you're going to find a ton of data on the connection between this and your inflammatory condition, okay? If you can actually lower insulin resistance, you can lower inflammation greatly, okay? And we want to do it through eating, okay? We want to change your eating. I've been in practice for 30 years, and every single inflammatory case that came in my office, because I dealt with pain and inflammation all day long, the diet was just filled with carbohydrates, okay? And they were eating too frequently. They were usually hypoglycemic, eating very frequently to have all these snacks, or they were pre-diabetic, or they were just doing a lot of carbs, okay? Tons of carbs. And what they didn't know is the relationship between carbohydrates and inflammation. So as soon as they got that knowledge and went on a low carb eating plan, inflammation just kind of went away. So, but you want to combine two things to drop inflammation. You want to go on a low carb, and we call that healthy ketosis. And you also want to do intermittent fasting, because that is even more powerful to reduce inflammation than just doing healthy keto. Now, if you've never heard about keto, I put a link down below of exactly how to do it. So I recommend check with your doctor, get on this eating plan, and experience no more pain, no more inflammation. You have to test this out for yourself to see that it will work for you. Thanks for watching. So I want to know about what you think about this video. So please comment below and tell me what you think.